So for those of you who've been watching for a few minutes, you thought I started and then we all disappeared. And we did. Technology is not perfect and we all got kicked off, perhaps other than you. So welcome again. I am Liz Krueger. It is June 30th and we are here for our third roundtable discussion of New York City reopens, a vaccine competency, vaccine hesitancy discussion. I'm glad you're able to join us. Hope you stayed on when we all fell off. Hope you're all safe. It has been 1 week since New York City entered phase 2 of reopening, and now we're on track to enter phase 3 on Monday, July 6th. The governor announced yesterday, however, that there are safety concerns regarding indoor dining being permitted at this time due to issues that have arisen elsewhere, as well as challenges New York City is facing with people congregating and not practicing social distancing. The governor said that a decision will be made on Wednesday, that's tomorrow, if you're watching live, about whether indoor dining will be permitted at this time. While my heart goes out to every restaurant owner who's desperate to reopen, I really don't believe we have set up a safe enough system for ourselves to shift into indoor dining yet. So I'm hoping that continuation of the broad open outdoor dining rules we have set in place will continue to help our businesses open and stay open and give people desperate to go out and do something besides sit at home an opportunity to participate in the outdoor dining. Phase 3 businesses that are scheduled to reopen: nail salons, cosmetology, appearance enhancement practitioners, massage therapy, spas, tanning, tattoo and piercing, waxing services. The plan is to open outdoor recreational areas for basketball, tennis, volleyball, handball, bocce, and dog runs as well. And my constituents have really been desperate for the dog runs to be open because the dogs are just as crazy sitting at home as we are. Governor Cuomo has issued a travel advisory which went into effect on June 25th. Individuals traveling from states with significant community spread must now quarantine for a 14-day period upon coming to or returning to New York. So that means if you're a visitor or you're a resident who left and is coming back from any of these states, you need to quarantine at home for 14 days. There are some exceptions, and we are sharing a link on this Facebook to the website that has additional details about the travel advisory. But as of yesterday, the states include Alabama, Arkansas, Arizona, Florida, North Carolina, South Carolina, Texas, and Utah. If you need to report someone who you believe is violating the travel advisory, you can call 1-833-789-0470. And it is quite possible that the number of states on the list continues to grow as the spread of the virus continues to grow. It continues to be critical that all of us wear face covering when outside of our homes, remain 6 feet distance from each other or those not living in our household with us, and wash our hands frequently with soap for at least 20 seconds. And if you're bored to death with singing the happy birthday song, come up with another song you prefer. Singing makes the washing go down more easily. I also want to urge you to be even more diligent about following the practices as we continue the reopening process and as large gatherings are permitted. There were 13 people who recently tested positive for the virus after attending a graduation gathering. Of course we want to celebrate people graduating high school and college, and they even do elementary school graduations, but we don't want to all end up sick because of it. So we just have to be smarter and more careful. So again, this is part 3 of my town hall series on reopening New York City. Part 1 addressed the spectrum of risk associated with different social activities. Part 2 provided an overview of the city's Test, Trace, and Take Care program. And this afternoon's town hall will focus on the importance of developing a vaccine in our effort to get control of the virus and for businesses to stay open as well as learn about vaccine hesitancy that exists and how to build vaccine confidence. As I have said endless times over the last 3 months, even though I'm in the business of politics, it's not politicians who are going to get us out of this crisis. It is scientists, it is doctors, it is public health experts like the one we're about to hear from. You hear politicians saying lots of strange things about what you do or don't need to do to protect yourself and others from this virus. I beg you, ignore us. Listen to the scientists, the healthcare specialists. There are amazing number of smart, thoughtful people who have spent their lives preparing for moments like this. They don't have all the answers. I've talked to many. Nobody thinks they have all the answers, but trust me, they have more answers than politicians on Twitter. And they have much better answers than politicians on Twitter. So I'm very pleased to welcome world-renowned anthropologist Dr. Heidi Larson, who is the director, get ready for it, of the Vaccine Confidence Project, a World Health Organization Center of Excellence on addressing vaccine hesitancy, and also professor of anthropology, risk and decision science, Department of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine. And yes, she is joining us from London today, which is why we are having this town hall sort of on British time. So before I introduce Heidi, reminder again, after her presentation, I will moderate a Q&A. We have questions that were submitted in advance, and you can also submit questions through Facebook. And now it is my pleasure to introduce Dr. Heidi Larson, Director of, I said it all before. So thank you for being with us today, Heidi.
Thanks. Thanks very much. Let me share my screen. Let's see. Oops. It's an interesting day for technology.
Yes, none of this is me working.
Okay, we're getting there.
Okay.
How's that? Yeah?
Yes.
Are we on?
Yes, you are on.
Okay. Well, welcome everyone. And as I won't get into the introduction, which was kindly just done, I'll move straight in, especially with our shorter time. I'm leading, which I founded 10 years ago, the Vaccine Confidence Project. I think as we think about the introduction of a potential COVID vaccine, we have to look at what is the context, what's the land it's going to come into. And as you all know, it is vaccines that once upon a time were as normal as brushing your teeth have become much more criticized and questioned for a multitude of reasons. And we need to navigate that landscape and build confidence to introduce and support a new COVID vaccine while being totally alert and aware of any risks as well as the positive benefits. The Vaccine Confidence Project, we set out to do a global mapping of what is driving the questions in different parts of the world, how many people are questioning, because I was previously the head of UNICEF's global immunization communication around the introduction of new vaccines as part of the launch of the Global Alliance for Vaccines and Immunization, and saw between 2000 and 2005 a growing number of outbreaks of rumors and concerns around the world. But we didn't really have a handle on what was driving it and how big was this issue. So we've been totally dedicated at the Confidence Project to do global mapping, to set up a global network of people on the ground to be listening and trying to understand public concerns so that we can address them, we as the public health community. One of the big things we learned is that a lot of the time, any issues and concerns around vaccines were not necessarily just about the products. They were about a bad or uncomfortable experience with a health provider, and they didn't want to go back to that clinic. It wasn't really about the vaccine, it was about the experience of the vaccination. Sometimes it's about lack of confidence in the policymaker and the systems that regulate, recommend, and sometimes require vaccinations. Maybe they don't have a problem with the vaccine, but because the government is telling them to do it, they don't want to take it. And that is happening in different places. So we had a test of the system and confidence around the world in 2009 with the H1N1 pandemic. And during that time, there was really quite an acceleration to get an H1N1 vaccine out there because we anticipated, and the World Health Organization anticipated, a pandemic that could have been as big as COVID, but didn't turn out to be that way. But in anticipation of that, vaccine production was accelerated, but not very many people came to get it. So in 2010, a group of scientists convened to try to understand what went wrong, and the report of that was published in a paper that they concluded was a crisis in public confidence. In 2011, I led an article in The Lancet about looking at the global situation. So already 10 years ago, this was clearly a trend. The next thing we tried to do is get some metrics to measure this, how big of it is, how do different countries have different levels of confidence, how can we learn that? And we developed a vaccine confidence index. And in 2015, we launched the first global study. And to my surprise, being an American who had moved to London, but I had worked in the UN in different countries around the world, I had the impression that the US was probably among the more skeptical, but found that actually Europe came out in the Global Confidence Index as being the most skeptical, with France being the most extreme in the world. I do think that there's a size issue here. If you look at the states, the United States broken down by state, you'd probably see a picture a little more like the countries in Europe, where there are pockets of more lower confidence than others. But nonetheless, this does give you at least a global sense and a benchmark that we can see, are things getting better or worse? Because people say, is this really getting worse? And frankly, we've never had a benchmark to say we're doing better or worse. If you don't have a comparison, you can't say whether it's better or worse. In 2018, the Wellcome Trust did their first global monitor, which is a global initiative monitoring public trust in health and science. And they did a special chapter on vaccines, and they used, among other questions, our vaccine confidence index to see what is the confidence in the importance, in the safety, in the effectiveness, and compatibility with religious beliefs and vaccines. Out of this, they ran this in 144 countries, which was more than our global study did in 2015. And you can see where North America is here. It's one of the, Europe is very high too. I mean, you can look at the level. Yellow is the strongly agree about in terms of confidence in vaccines. And you can see the differences across the regions. What's the landscape that we're in anticipating a COVID vaccine? Well, we have a mix of emotions, access issues, and attitude issues. And typically, historically, the vaccine immunization community has been much more focused on access, making sure everyone has access. And if there was under-vaccination, the assumption was there was a problem with supply, or people not being able to get it for conflict reasons, or being remote from the source, assuming that people would come to get their vaccines if they could. But we've seen that that's clearly not the case. Increasingly recognize the emotional domain of people's decisions about vaccines. And one of the things we've learned in running our vaccine confidence index over multiple waves since 2015 is how volatile people's opinions about vaccines are. They're almost like political opinion polling. 10, 20 years ago, if you did a study on public attitudes about vaccines, you could probably refer to that study for a few years, and it would be relatively stable. But that's not the case now. The European Commission has asked us to rerun the index in Europe to measure the change between 2015, 2018, and we're just getting the data in on 2020. There's a lot of change across countries. Some become more confident, some have dropped in their confidence. So these are sentiments we need to keep our finger on to understand and anticipate when confidence is going down, because when confidence starts going down, that's the time that we need to engage and understand what are the issues, what are the concerns before it affects people's willingness to take a vaccine. So in the context of COVID, and now we have some issues with just the access and the stresses on health systems are affecting access to routine childhood immunization. This is the Global Measles and Rubella Initiative. Estimated that about 117 million children are at risk of not being able to get their measles vaccines around the world just because health systems are focused on COVID. And those who still have access to the systems are afraid to go there because they're afraid of catching COVID. So there's a mix of concerns. In the United States, there's also been a drop in ordering supplies for vaccines, partly because of the demand, but also because of the systems are right now very overstressed about COVID, but the normal systems are not working, and people are also, again, hesitant in the context of lockdown to go into clinics, to leave the house. If you're under lockdown, you're not going out to get a lot of things, including vaccines, and it's had a real effect on other health issues. We've been collaborating with some of our researchers in different parts of the world, and one group we've worked with in France ran a survey on anticipating willingness to take a COVID vaccine, and 26% of the respondents in France said that if a vaccine against COVID became available, they would not use it. Well, actually, City University of New York has been running a number of pulse surveys, and they've also found that, along with a couple other surveys, that in the US it's actually about a quarter of the population who would be hesitant about a COVID vaccine. So we can't assume, even if we get what seems to be a highly effective or effective enough and safe vaccine, that people will necessarily get it, accept it. So that's something that we have time, because we don't have the vaccine yet. So we have time to create awareness about the vaccine, what it would involve, why it's important to take it, and who would be getting it. Some of the other questions that the City University of New York had in collaboration with Emerson Polling ran is in a number of countries they asked this question about willingness to take it, and the US was in the lower third. You can see the spectrum of acceptance. Here it says 60% in France would be willing to take it, but there is the 26% we're saying would not take it, but there is a middle bar that would be undecided, which explains the difference there. And they rightly so, if we want to understand who are the influencers, they asked, I believe, questions about confidence in government and the business community. Are they working together to restart the economy safely after COVID? and the confidence you can see the U.S. is in kind of the top of the lower third. But that kind of confidence in government and the business community does weigh in on people's confidence in the vaccine that a government or government is recommending and providing, and a business community is producing. Let's see. Whoops. Looks like this froze. Oh, there we go. The last group, and I just have a couple more slides that they asked is, would I follow my employer's recommendation? Because that's another influencer to get a COVID vaccine. And that actually raised the confidence a bit. What was interesting is that there was higher confidence in an employer's recommendation than in government or business. But that also might be tied to the fact that in the context of COVID, your employer might say, you can come back to work if you have a COVID vaccine, which is a whole new dimension on the value of a vaccine, because in the case of COVID, it could let us go back to school, back to work, in addition to the health benefits. And I'm just going to leave it with there, but I've written a whole book on this phenomena, and it's just coming out next month. So if you want to read more, a quick advertisement for it. And it has the beginning is about COVID. Thank you very much.
Thank you. Thank you so much for your presentation, Dr. Larson. And yes, we've been living with vaccine fear here in the United States. I mean, the New York State legislature passed a bill requiring children get the vaccine for measles. Vaccine for measles, or they could not go to school. And that set off quite the scene in a variety of places, with people, saying that they were being forced to keep their children home and homeschool them, and how could we do this to them, and are continuing to have discussions. I personally, being the second lead co-sponsor in that bill, facing a lot of hostility from some people saying I was preventing their children from getting an education. I explained I was not doing so. They could have their child vaccinated and get them right back in school within a matter of days. They were choosing to put other children at risk because they wouldn't vaccinate their own children. And it was fascinating to me to hear some of the myths that people were sharing with me as the driving force for them. So I think it's so important to be, as you've spent your life working on debunking myths and trying to help people understand the real risks versus the false risks of vaccinations. Since you brought up in your slides the concern about people not getting normal vaccinations for children because everything is sort of out of whack in the health system now, is not getting the normal vaccinations most people are getting for their children going to increase risk of COVID in some way? Is there a correlation between getting all the right vaccinations, even if we don't have a COVID vaccination now, or facing greater risks? Like, are you at greater risk of COVID if you get the flu, if you get measles? I'm just curious.
Oh, well, you're not at greater risk of getting infected. You may very well be at greater risk of getting serious illness and dying, particularly with something like the flu, because COVID is already putting tremendous stress on your respiratory system. If you get another respiratory ailment like the flu, already, I think people forget, a few years ago in the U.S., 80,000 people died of flu, just seasonal influenza. I mean, this is clearly more, but if you put those two together, it's not a pretty picture.
So actually, when I woke up today, the newspapers had stories of the head of the CDC saying that she no longer believed we would be able to get our arms around controlling COVID in this country and the surging that was going on now in 36 states until we had a vaccine. So she put even, it seems to me, greater emphasis on are all having to hope we can get a usable vaccine as soon as possible. But I know from a number of the early questions we got, people are a bit concerned about how do you know when they come out with a new vaccine that it's actually safe to take. So I'm wondering if you could help my listeners understand sort of why, when there finally is a vaccine, or perhaps more than one vaccine made available, that there is a level of confidence we should all have that this is safe for us to take.
Well, vaccines are never approved until there's kind of a minimum amount of safety relative to the risk of the diseases. So this is an emergency context, but no company, no government would want to take a risk where they felt like there would be harm caused by a vaccine. But vaccines, the reality is there's a lot of trials with thousands of people. Starting trials always start with healthy people, and then as the confidence in the effectiveness and safety grows in the trials, they move and they trial it with more vulnerable people, including children, pregnant women, elderly. So that process is starting now. There are maybe 7 to 10 in first phase, but have to go through a few phases of trials. And there are longer term, what they call post marketing surveillance after a vaccine has started to be released. Sometimes there are things that got picked up later, but there's a lot of vigilance around that. So for one thing, we are not going to get the vaccine as quick as has been advertised. And one of the biggest concerns we're picking up in our global social media monitoring and survey work is a public anxiety, and that it's too fast, it can't be safe. And what we hear in the newspaper sounds like it's going to be faster than it is. It is certainly more moving at a more rapid pace than previous vaccines. That's partly because of new technologies, new approaches, but it is not going to be with us next month at the level of being available to the public. There are vaccines produced that are being trialed, but I don't think we're going to have a vaccine in time for the current outbreaks going on now. I mean, we won't. We will, but what will be crucial is if we have a second wave and if there's tails of this pandemic, particularly around the flu season.
So can you just help us understand the difference between whether a vaccine prevents you from getting a disease or a vaccine ensures you get a much lighter version of the disease, and will there possibly be multiple vaccines with different storylines at the same time?
Yeah, vaccines you have preventive vaccines, and as you mentioned, therapeutic vaccines that can mitigate the vaccines now being trialed are to prevent, primarily to prevent. There's a lot of what they call antivirals and drugs to work on the treatment and to mitigate seriousness of illness and death. COVID is an extremely complicated virus. It is not straightforward. It is not the flu. It has, at first, it wears your immune system, and then there's a point where in some people, after the initial infection, your immune system goes into overdrive and creates other problems. And you've seen, I'm sure you've been reading in even the general press, the range of symptoms is hugely diverse.
So let's go back into sort of your specialty area. I thought it was fascinating that the research on different countries is some country people have more faith in their employer than their government, and so
Yes.
conceivably, if their employer says, "Hey, we're all getting vaccinated," they'll say, "Okay." Now, very possibly, they'll all say, "Okay," because they don't want to lose their job. Do
Yeah.
you, as a professional in this field, think it's okay to set up a scenario where employers and or schools and or governments say, well, it's your right not to take the vaccine, but we're making you quarantine in your house forever and not go to work, school, or do anything? Because that's sort of the implication that will will make them get it.
Yeah. I think it depends on, well, one, the nature of your job, of course, but I think people are feeling pretty fragile right now about their employment and their jobs. And if your employer in this context says, we really don't want you to come back to work unless you've had this vaccine for the sake of others, you, I think people want to hold on to their job enough that, but I think employers also can be important influencers. You might have a good rapport with hopefully you have a good rapport with your employer and trust them more than you might trust your employer that you have depending on the nature and length of your work relationship, you might have more confidence in their views than you do from a government institution, which is clearly the case from some of the survey work. So I think, especially in the context of COVID, we need to think of a very different mix of influencers around vaccines because, it's a messy space, but it's also having a huge impact on sectors way beyond health.
Right. So give us some examples of what you hear are the common COVID-19 vaccine rumors that you're aware of at this point and what the truth is. Because I do think a lot of our jobs, once there's a vaccine, is going to be to both encourage in every way possible people to take it, but also to do what I call whack-a-mole on the false information going on
Yeah.
vaccines.
Well, I think there's rumors and then there's anxieties I think some of the anxieties are concerned people. But the rumors are, you've probably seen some of them, everything from the 5G rumors that 5G is causing COVID itself, and that falls into the rumors. But I think some people don't remember that 3G supposedly caused H1N1 and 4G was causing SARS. So there is a school of thinking that, and then there's, as we've heard, the belief in some of the bleaching and alternative therapies that can actually harm you rather than help. So there's rumors about alternatives. There's a lot of rumors about alternative treatments. And if people feel like there's an alternative treatment and they're not confident in the safety of a vaccine, they might opt for a whole mix of everything from drinking water, eating garlic. The president of Madagascar is promoting a new bottled COVID organics. And other African countries, some of them are apparently ordering it. It's probably not, some of the health alternatives may not harm you, but they're not going to stop you from getting COVID. And there's, a lot of the rumors suspecting, manipulated virus. There's that too. And then what's interesting is that they're repurposing a lot of old rumors to fit the COVID scenario. So we're seeing this merging of a lot of previous rumors that are coming together in this heightened uncertainty that we're living in right now. And the problem is with COVID is that it's brand new. Even the scientists are learning every day. So you don't want to be debunking everything because maybe there's something in it. Maybe there's a new aspect of COVID which we didn't know about. So I think we have to be very careful about, I mean, some of it is blatantly wrong. That's different. But, you know, some of the symptoms people might be getting are important to listen to, how they spread, infectiousness, something important to listen to.
So one of the issues that seems to be sort of being spread around the world is that um, locations that butcher meat are the trigger point for COVID. Now, certainly we've seen a huge number of people who work in meat plants in the U.S. having come down with COVID because it seems like they are working very close together. They're not wearing proper equipment, and their employers weren't following the social distancing smart
Yeah.
employment rules. But is there anything to this? You know, you should be worried if there is a butcher somewhere near where you live. That is a trigger. I thought that that wasn't true, but I keep hearing about it.
Well, I think people, use their common sense. I mean, they try to come up with explanations. I mean, if you do leap to the question, well, if all these people working in the meat industry are getting it, maybe my butcher has it. But indeed, I think, as you said, those are situations where people are working very closely together, don't have the protective gear, and also because of the loud sounds, they are having to speak and even yell louder, and any singing, speaking louder, having to raise your voice, the spread of the particles, including virus particles, are heightened 10 and 100-fold. And so there's multiple factors in those situations that are really hotbeds for the spread of infection.
Hence the unlikelihood of Broadway musicals opening again anytime soon, much to many of our chagrin,
Yes,
because
yeah,
all these
exactly.
fabulous singers singing out over the audience.
And sports events, it's the same.
Same
Yeah.
thing, exactly, exactly. Um, so when you're talking to people about how to get past their fear and to get past rumors and myths about vaccines, what strategies do you find work most effectively?
Well, the first thing we need to do is understand what some of the concerns are. I mean, one thing that I found, I think historically in the public health community, a lot of the communication has been very much driven by what the public health community and the scientists uh, think you should know. And that's important, but there was not a whole lot of room for dialogue. And what we're facing now is a very different public, partly because of the communication environment, but also there's a lot of other democratization and other issues and rights issues that have kind of make public more outspoken in their views, which fair enough, but we need to listen to them. So I think one of the things that one of the reasons we've set up this confidence project is to try to listen more to public concerns. And we play in a way, a translational role, giving briefs to policymakers, people designing programs to stay. When you're designing your program, you need to take into account what the public concerns are. And in addition to these, the things people need to know at a very practical level, think about how you deliver it. Think about these are the things they're worried about. And what else is going on? What other concerns are there? Because people are never dealing with one risk at a time. They're thinking about multiple things and they're weighing, which one is going to be a bigger concern.
And are there specific reliable resources that you would refer people to fact check truth versus misinformation and rumors? Are there like a couple of websites you would suggest people can use to get verified, the difference between myths and realities when it comes to COVID?
Well, in the vaccine area, I think one of the best initiatives is the vaccine safety net. It's called, and it's like it's the equivalent of a good housekeeping seal on websites. So I think of that when, if I could give one reference, it's the vaccine safety net, because they have a list of websites that they have reviewed thoroughly, and feel like they're confident sources of information to go to. And there are a number of them. And there are a lot of good things coming up on fact checking. But a lot of what's driving the rumors are not just about facts. I mean, I often say we don't have a misinformation problem, we have a relationship problem. I mean, if you just clip the heads off of these rumors and don't deal with what's driving them and the roots of them, they're going to keep coming back or move somewhere else.
Exactly, which is sort of why I think my real question and my real assignment as an elected official here in New York is I want to come up or help come up with the strategies that will most encourage vaccine confidence in New York City and state when it becomes available. And I also want to help come up with the best mechanism to ensure easy and broad distribution of the vaccine once it is available. And as you talked about, prioritizing participants who should really get it sooner than later. I mean, we now have 200 sites that you can do free testing of COVID every day in New York City. I assume you think we should have that, if not more, sites available to offer free vaccinations once the vaccine is available? And do you see mass distribution as the right route?
Well, to the extent we have the vaccine available, but that's the kind of thing you can already start listening to the community and talking to them and finding out, well, when we have a vaccine, if we get a good one, where would be the best place for you to go? I mean, where would you want to get it? And the more people feel like you care about their views and you want to make it, in a way that they are considered and their concerns and issues are considered, already you're making, that's important, because a lot of people just feel like, we're just a number, it's another vaccine, next. And I think one of the things that has started to change the landscape in France is that they've really done extensive efforts at public consultation and kind of town hall approaches, but also really there are reasons we have to have virtual ones now, but in real, real gatherings, small and large, and engaging people outside of the normal health system to, start to talk about how they'd like to see this thing delivered.
I think that is a really critical lesson for New York because, of course, one of the things that we've seen in the U.S. in general, but very real in New York, is that there was a disproportionate impact from COVID, the disease, on communities of color, where they already had a much higher morbidity and lower mortality rate because of a whole host of socioeconomic issues and systemic racism built into our healthcare provisions. So it's one thing to say, okay, everybody who has a private doctor is likely going to be approached even through their private, doctor about the reason they ought to be getting a COVID vaccine, particularly if they're in a high risk category. Again, in poor communities in our city where people are very unlikely to have private doctors, are very likely to get their health care not in a preventative model, but when it's too late and they get rushed into an emergency room or hospital. And now, of course, everyone tries to avoid hospitals because of fear of COVID spreading throughout. I do think it's really critical, even though I'm not sure exactly how to do it, how to make sure we're bringing every community in to talk about what would be the most effective way. When I think of work I've done over my career, sometimes when you were trying to reach out in low-income communities and community of immigrants, working through their churches and their ministers can be effective. I'm wondering whether that's a model that you've seen be successful anywhere in encouraging sort of the right messaging around vaccinations.
Well, I think in some communities, that I mean that's the other thing to understand: who is the trusted leader? Who is, for some people it's your employer, and other places it's your local rabbi, imam, or priest, or whatever your belief system is. And I think that's one of the things, as a confidence building effort, is to understand who are the right people to engage in this effort. Also, not just for vaccines, I mean, for supporting this overall COVID response. We don't have treatments and we don't have vaccines yet. So we need, who are the people rising up in the context of the current situation that are making a difference?
So sometimes you hear these sentences thrown around. We could never vaccinate all 300 million Americans, so stop getting so excited about vaccines. Realistically, you're right. I'm sure they're right. We won't get all 300 million. But is there a target? Do we need to get 200 million? Do we need to get that 70% mark that I sometimes hear thrown around? I mean, what is realistic that we can aim for, and then, send out our troops, so to speak?
Well, you're right. It is, the estimates are around 70%. Some say a little less, some say a little more. We won't know till we have the vaccine, because they're not likely to be 100% effective. So that'll also influence it. Well, I think that, when they talk about herd immunity, it'll be in certain settings too. So, you might need to focus on areas where you've much more risk. I mean, ideally you have it widespread. And we shouldn't forget, there's a lot of people who have been infected too. So that'll add another effect. We can't rely on that. I mean, there's just been a study across Europe looking at different countries and, how much has herd immunity possibly weighed into their leveling, their amount, especially places like Italy and Spain. But they've absolutely seen that when you compare different countries, it's totally to do with the different policies and different approaches, and none of them have really achieved the flattening because of herd immunity.
And I guess I would make this the final question, even though we have so many more, but because we got cut off and started late, and I know you have to get out of here on time. If you were to look at the research you've done in your lifetime, what's been the most effective model for moving people into vaccination? Might not have been here in the U.S., but is there one example you can leave us with that was the most effective use of vaccinations?
Use of vaccinations or involvement of public?
I guess involvement of people, getting them vaccinated so that we, yeah.
Yeah. I think one of the best examples was in Denmark. They had some anxieties about some side effects with HPV vaccine that were not found to be related to the vaccine, but the anxiety was there, even though the link was separated, not confirmed. But the overall HPV vaccination rates dropped. And what turned that around was the health authorities actually engaged girls of the HPV vaccinating age to co-create a social media strategy that really turned things around. And I think it's an example of the importance of collaborating closely with people who are affected, people who, you want to be involved and engaged in, and in ways that they know how to reach their peers. And I think that it was a really important message, and I've seen that in different countries. I've seen a lot of refusals of vaccines because people felt excluded, in the same way where I've seen when there's engagement, there's more willingness. There's some that are not going to take it no matter what you do, and they've got their reasons. But for those who are in the undecided or the hesitant groups, the more there's an engagement, the more likely we see that there's a willingness, or at least an openness.
I love that example, thank you, because I also, right now I've been very effectively lobbied and working with youth activists on climate change. And they are passionate and smart and organized, and they see that survival of the planet is dependent on their being successful. And they're extraordinary. And I'm talking high school students, through college, and they're extraordinary. And so I feel like, okay, next assignment, young people, you want the planet to be here for you. We do too. And you want to be able to live on this planet free from the diseases that will prevent you from doing anything you hope to do. When I look at the social movements marching in the streets around Black Lives Matter and other policy issues now, that's also disproportionately young people. So I think that's really important as a takeaway, that we should be talking to these exact same young leaders about how we message the importance of taking the vaccine once we actually have one that works. So with that, I want to officially thank you so much for being with us today. Thank you for humoring us during the technical problems we had. I really appreciate it, especially since you're in London, that you could figure out how to make the time to speak to us. I know that my audience is very appreciative, and that we will continue to be doing this work and looking to the scientists and experts like yourself to help direct us to get to the right answer. For everybody watching, you can always reach out to my office via email, phone, text, and we will follow up with you. We haven't announced our next virtual town hall yet, but when we do, we will be sending that announcement out to everyone. In closing, stay well, stay safe, wear a face covering over your mouth and nose, stay 6 feet away from others who you're not living with when you go outside, and as gracefully as possible, keep messaging why all of us staying on top of this issue is the only way we're all going to get through it. Liz Krueger here. Thank you so much. Goodbye.
Thank you.